Welcome back, dear viewers. The Health Ministry has conducted more than 1 million surgeries in the Waiting Lists initiative. Over 1.5 million surgical operations have been conducted under the presidential initiative dealing with urgent waiting lists for surgical procedures. The presidential initiative, which was launched in July of 2018, continues to work despite the coronavirus COVID-19 crisis and the post-crisis period. The average number of operations performed has increased to avoid the accumulation of new lists. This is particularly in regards to certain cases such as open heart surgery and other cases. And we have with us now Dr. Magdy Adly, the Senior Manager in Healthcare and Quality Control Management, to tell us more about the issue. Dr. Adly, always a pleasure to have you with us. Thank you.
Thank you for getting me this afternoon, and a very pleasure to be with you this night.
Great pleasure to have you,
Thank
Dr.
you.
Adly. First of all, President Assisi has ordered to finalize patient waiting lists in all public health sector hospitals. So how far the Ministry of Health was able to fulfill this goal?
In the beginning, a waiting list is a feature in all countries, by the way, and that with a public founded health system such as Spain, United Kingdom and Canada and many countries. And despite countless well-meant initiatives in all these countries are initiatives to eliminate them. Their resistance and frustrated the governments and the public payers. But the question is, could we finish that waiting list or not? Before I address that question, let me tell you something very important, which is,
please,
if we make a prolongation for that waiting list for a certain or a highly sensitive surgical operations, regardless to the humanitarian or economic reasons, but the problem is the outcome of that surgical operations may be worse. So that was the vision of the government and even the leadership from the beginning.
Yes.
And they launched the initiative of waiting list by July of 2018, before even the crisis of COVID-19 and even through the crisis and both the crisis. And by the way, that was a very hard load for the health regime in Egypt, in fact. But we succeed right now to eliminate or to finish like 1.5 or more surgical operations of different majorities, like cerebral surgeries, like kidney implantation, like liver implantations, like internal Nile surgeries, like open heart surgeries. And by the way, these surgeries before was a very high challenge for the every Ministry of Health and before, because you know these surgeries are costing a lot of money. And by the way, the government make a budget for that purpose. It's with a high, a very or a lot of money for that purpose, because you know these surgeries are classified to minor, moderate and major surgeries, and sometimes called highly skilled surgeries, which need a certain type of equipments, a certain type of medical supplies, even a certain type of medication post-operative. So you are talking about preparing the patient before the operation, then the surgical operation itself, then the post-operation after that. So all these steps are costing a lot of money for unable patients. By the way, that was a very hard to make it, and the problem was there is no in the past, I mean, there is no more hospitals, public hospitals or university hospitals to do that. But now, Ministry of Health make agreements with many different hospitals, not only public or university hospitals, even the military hospitals, even the hospitals of Ministry of Interior, a private hospital even are sharing with that purpose. So that in the end makes shortening of the time which is taken to for waiting your
to get the operation,
the operation, yes.
And that makes the results better.
This is right.
Yeah.
And make it very easy. And for example, open heart before taking like from 6 months is up to 1 year now. The maximum period of time is like 3 weeks maximum from starting from the introduction of the medical data till the finishing of a surgical operation. And this is a very good recording time for that kind of operations.
Indeed, Dr. Adly, another big story of success, of course, was the President's 100 million healthy lives initiative. How do you assess the degree of the success of that campaign?
We are talking about waiting lists, but the success of waiting list because of that initiative of 100 million health initiatives, because 100 million health initiatives targeted two main points. First is the treatment of a chronic disease, as you know, like diabetes, like hypertension, like obesity, and other chronic disease. In the same time, it succeed to make a medical database for citizens, so that we succeed to build a database, a network, so that help in for acceleration of waiting list. To get it in very short time, and in for the initiative itself, it succeeds to eliminate some very hard diseases like HCV or hepatitis C, which was one of the hard obstacle on the way of Ministry of Health. Yeah, because you know, in last times, Egypt was recording as the first a country for of numbers of patients of hepatitis C. Now we are talking that Egypt is closely free of hepatitis C, and
Excellent.
by the way,
that
is a great job, and even it costs a lot of budget, but in the end we can eliminate something which is very harmful, and that will come back or feed back to the international economy with benefits.
The WHO, the World Health Organization, right, congratulated Egypt on the success in this regard, and it also, Dr. Adly, congratulated Egypt on its new universal health insurance law. Could you tell us more about that new health insurance system?
Look, this is a great question, by the way. WHO is and its experts are watching Egypt all the time and watching what happened on the ground. from success like that initiative 100 million health and even elimination of hepatitis C, early diagnosis of breast cancer for women, the uh, uh, the early diagnosis of anemia and for students in schools, or so that they put Egypt on a right position on the medical map, and congratulate Egypt for that, and even ask Egypt for transferring that experiment of elimination of hepatitis C to other states, even European states. They come to take the medication treatment of hepatitis C from Egypt here.
Yes. And how do you like the public awareness about health issues nowadays? The raising of the awareness.
This very good question. By the way, these initiatives make a very good step, which is increasing the awareness of the citizens. Because when you talking about healing or taking a treatment for certain disease like that, the patient himself are contacting with Ministry of Health through introduction of his medical data. So he supposed to have awareness about his case, the health state or situation of his
Yes.
medical file, and which is avoided and which is permissible permitted for him, so that the health awareness among the citizens have been increased. And this is a good step, by the way, because you know in advanced countries medical informations and medical expertise is very in a very good scale. So we need that to spread that awareness more and more, to be safe from many disease even, because when you know more information about COVID-19, so you can avoid yourself from infection of COVID-19. If you know more information about HIV or HCV or HBV, you will take your precautions to
For sure.
avoid yourself from infection of these disease.
Sure.
So a medical awareness is a very good thing to be spread among the citizens. And I, from your program, I invite channels or TV channels to increase the programs of health and medical information for the public, because this is very good for them to decrease the spread of disease. And this is the direction or the plan of the state nowadays, to eliminate disease from the beginning, not stay for a long time to be worse, be worse.
Take the precautionary
Yes,
measures
this is right.
instead of having to react.
This is
Yes.
right. Every initiative now are targeting something before to become a very big problem or big crisis.
Right.
So we don't need to have a lot of expenses to treat that problem.
Well, certainly a lot of successful initiatives, like, for instance, the waiting lists initiative. More than 1.5 million surgical operations have already been conducted, as mentioned. Of course, the 100 Healthy Lives initiative, the way we fought against the hepatitis or C. On all of this, the new insurance, health insurance system, and all of this has led, to the belief that Egypt is playing a role as a leader in the region, and especially in Africa, in the domain of health and Medicare. Could you expand on that, Dr. Adly?
This is right. And by the way, this is the future plans for our political leadership and his assistants to Egypt to be the regional center for many aspects, including medical aspects, like manufacturing of different medication. And you already having a very good market, because you are not, you know that you are the gate of Africa from the north, and Africa still need more and more, by the way. And you can find a market for these products, even not even medication, a medical service itself. If you have a lot of hospitals and have a good qualified doctors trained well, so you
Doctors
have
and nurses.
Yes,
Yeah.
even nurses, or even pharmacists, even chemists. So you will get a good reputation, a good medical reputation in Africa. So you will see Africans come to Egypt for getting or having the
treatment. Yeah.
Yes. So that will become a very good for even international economy, by the way. And we are welcoming with our Africa brothers to come and getting a medical care services here
Sure.
in Egypt, for sure.
Sure. Dr. Magdy Adly, the Senior Manager in Healthcare and Quality Control Management. Thank you very much for being with us.
Thank you
for your insights, sir.
Thank you.
Dear viewers, please stay with us. Nile Cruise will resume in a short while.